Hi, Dr. Henry and Minister Dix. Wanted to ask you about this healthcare worker announcement. Are you expecting any legal action challenging these directives?
You know what? There's a couple of things that we've talked about. That's obviously we've got a legal advice around this as well. I had a conversation with the privacy commissioner about requiring of this type of information, and he is very supportive as this being a proportional and reasonable response to what we know is an ongoing risky situation. We know that particularly in long-term care and a senior assisted living, those are the settings where those who are most impacted by this virus are living, and even though they have very high rates of immunization, we need to provide them with the best protection possible so that they can have the quality of life that we expect for our seniors and elders. And do you want to add to that?
Obviously, legal action will be taken by other people, so it's we think we're obviously on a strong footing here, but there is going to be a lot of work done over the next period with healthcare unions and with healthcare employers across the system to make this effective and to make this work. And we're going to be also making every effort, of course, to continue to give people the opportunity to get vaccinated, increase vaccination levels. So there's a lot of work to get together. We've announced our intention and the date, which is October 12th, and we're going to do a lot of work together in the coming days and weeks to implement and to put in place these measures, and we'll be working with our healthcare partners to do that.
Follow-up, Marcella?
Yes. What problems, if either of you could elaborate, I think Dr. Henry would be best to answer this, but what problems have you encountered with certain care home operators? I'm hearing about some private ones, especially in the Kelowna area, not granting access to visitors now that those restrictions have been lifted, and will visitors be allowed to visit their loved ones if they're not vaccinated?
Well, and Dr. Henry will talk about the requirements with respect to visitors, but very clearly, and I'll say this to everybody, given what we've gone through together in this pandemic, and those people who are visiting by definition people they know, and in most cases people they love in long-term care. I think it's our expectation that people will be vaccinated, and if they're not vaccinated, there are of course a requirement to say whether they've been vaccinated or not. And if they're not vaccinated, there'll be measures taken because there'll be periodic visitors to the facility to ensure that people are protected. But my message to everybody, whether they're visitors or volunteers or anyone else, is that now is the time, and the opportunity exists. Now is the time to get vaccinated, because I can tell you, as someone who visits in long-term care, that what is tremendously affected when we declare an outbreak in long-term care, and there are outbreaks in long-term care right now in the Interior Health Authority, is the ability for people to go in and support their loved ones and be with their loved ones, to take advantage of the changes that have been made in visitation to make that possible. So we want everybody to get vaccinated, and that is particularly for people in long-term care. I'll just say finally that, as you know, we're working very hard in our capital plan to eliminate as much as possible multi-bed rooms in long-term care. But when you're visiting, even though you're visiting and you are required to go to the person in question, nonetheless, I think it is not just the responsible thing to do, the human thing to do, given these circumstances, to get vaccinated, whether you're a visitor or anyone else going into long-term care. And that's good.
Next question is from Colton Davies, Radio NL.
Thanks for doing this. If I heard right off the top, Minister Dix, you mentioned the vast majority, I think you said, of long-term care and assisted living staff are already vaccinated. So just curious if you can elaborate what percentage of staff are not vaccinated. And I believe you just answered it with Marcella's question, but visitors to care homes who are not vaccinated, they'll still be allowed, but we'll have to wear masks and other safety measures, I presume?
Yes to the second. Very significant majority of people are vaccinated, of course, high number of residents. And what the requirement for information will give us the comprehensive view of where staff are at and what we need to do. But I think here's what I would say in general about vaccination. Let's give you an example. In the community I live in, Renfrew Collingwood, vaccination rates over 12 are 91.2% in the general population, which is high and is impressive, and very grateful to our neighbors and to everyone involved for seeing that happen. Over the whole province, over 12, it's about 82.3%. Not about, it's 82.3% today, which is a very significant level of immunization compared to everywhere else. Above 50, there isn't much regional variation, people who are aged above 50, between health authorities. So the level of people over, let's just use seniors, so we'll say over 65, vaccinated in Interior Health is not very different than those vaccinated in Vancouver Coastal Health, where I live, or Fraser Health, or Vancouver Island Health. The difference, the significant differences, are under 50 by health authority. In different health authorities, there are significant regional differences for people under 50, and we've got to address that, and that's been part of our Vax for BC effort, and we're making some progress in many communities, notably Kelowna right now. In terms of Kamloops, where you're from, Colton, it's about 80%, which is very good compared to just about anywhere in the world, but there's something that's better than 80%, and that's 81. And there's something better than 81, and that's 82. So we got to continue to grind it out and work hard to see that happen. So there'll be comprehensive reporting on these questions, but we have exceeded our initial goal of healthcare workers being vaccinated. But given the circumstances, we need, I believe, that level in long-term care and assisted living to be 100%. And that's obviously what Dr. Henry believes, because that's why she brought in this order today.
Do you have a follow-up, Colton?
Yes, please. Thanks for that answer too, Minister. So with this being announced today, coming in October 12th, does this open the door for potentially mandating masks in other workplaces where there could potentially be people at risk, such as hospitals, for example? Obviously, businesses can require, not admitting, I suppose, people who are not vaccinated if they choose, but could this also open the door for a mandate for certain businesses that might be considered essential as well, like grocery stores?
I'll ask Dr. Henry to answer that question as well. Obviously, she's already noted that the work we're doing in education and post-secondary education is ongoing, and you'll be hearing more about that soon. Today, what's being required in long-term care and assisted living is mandatory vaccination for all those working in those facilities as of October 12th, and that's what's being announced today. There are other measures that can be considered, and we're looking at all measures to protect people and adjusting what we're doing in keeping with the circumstances and keeping what we know. We have highly vaccinated, in the context of the world sense, a highly vaccinated population in BC, and that's great. We need those numbers to be higher, and they will be, and we're continuing to work to see that they will be. And if other measures are required, I know that consideration is made every day, not just in specific workplaces, but across the population. It is not mandatory for a citizen to be vaccinated in BC, but there are things that you may not be able to do if you're not vaccinated, and that's something that's, I think, obvious, and something that we're reflecting on now. I'll hand it over to Dr. Henry.
Yeah, so when we think about public health orders, what we try and do is put in place orders that are proportional to risk and the type of risk that is being experienced. And so when we look at long-term care, we know that the vast majority of residents are immunized, and the majority of healthcare workers are immunized. And in many, many facilities, it is 100%. So this won't impact them. But in some facilities it isn't, and it can be quite a bit lower even than the average in some facilities around the province. And this really speaks to a level of risk that leads to severe illness and death. So that's important, and that's why we've put in orders, particularly around people working in these high-risk settings. Yes, we are looking at other high-risk settings, like other healthcare settings. The level of risk is different in an acute care setting versus the communal living setting, like long-term care. It's also fundamentally different in community settings. So if we look at schools, we don't see a high risk of severe illness. We don't see any deaths associated with schools. We see that schools are a safe place, for example, and we saw really good drop-off in cases when we had immunization of teachers and school staff, which we prioritized. So the level of action that we need to take to prevent severe illness and deaths is different in different settings. And yes, we are looking at that. As I mentioned, we're talking about schools, we're talking about some of the communal living settings and post-secondary institutions, but we've also been a focus on workplaces. And you may recall early on when we had vaccination, we targeted vaccine early to some of the high-risk workplace settings, the food processing settings, for example, the farms where people are living in communal settings. And immunization has made a tremendous difference in those settings, and we're not seeing transmission and outbreaks in those settings. So those are the places that we're working with industries to make sure that measures are in place, the communicable disease plans, the important pieces of the COVID safety plans that work to protect their workers, because that is important for business as well. And we see that in the central Okanagan, where unfortunately we had transmission amongst staff, and businesses can't operate with that many staff ill, and it meant that we had to put in some more reductions and restrictions in those areas. So yes, this is important for all of us across the board, but where we know the most impact is going to be is where we've put orders in proportional to that risk of severe illness and death, and right now that's a focus on long-term care.